We're going to review fluorescein angiography injection and IM injection for the boards. You want to follow along with the pre-printed form. So first you want to do is wash your hands, completely dry them. You're apparently going to prepare a field with an aseptic drape, so that would go down. You're going to verbally confirm and state appropriate medication, concentration, and expiration. To help you guys out, we provided a real empty bottle of fluoro. So it's sodium fluorescein, or aka fluoro, 10% injection, 100 milligrams per milliliter. And the same with the epinephrine, it would be 1 per 1,000 micrograms of epinephrine. Then they want you to prepare the medication first. So you clean the top with a stopper and the alcohol prep. And assemble your syringes. Okay.
He's just doing a video real fast.
Your 3 cc syringe, you want to take the cap off.
Okay.
And you just twist on, keeping that on. With these vials, they're pressure neutral, therefore you have to put as much air in as medication you're getting out. That way when you pull the medication you don't provide a pressure vacuum.
Okay.
So for this, we're giving 3 milliliters of the sodium fluoresceins. We're pulling back to the 3.
And the bottom, the top marker is where it is?
Correct,
Okay.
not the point at the top.
Mm-hmm.
And you're going to poke the vial without touching it until the needle's in. Then you invert the vial. You inject your air and pull back to your desired dose.
Okay.
You want to make sure that there aren't any significant air bubbles.
If there
the
is, do you
little
just...
guy right there you're not going to get rid of, but the one at the top we just push forward.
A little bit? Okay.
Yeah. There we go. We were able to get rid of some of that. And if it's stuck on the side, just flick it a couple of times.
Okay.
There we go. So we're at 3. We're going to recap, because it hasn't been used yet, using the one-handed scoop technique.
Okay.
And the sodium fluorescein is drawn up. We're going to do the same thing with the epinephrine.
Okay.
Clean the top. Assemble. This is a smaller diameter syringe because we're only giving 0.4 cc's.
Okay.
Still has a cap on it. And with this, it's not a twist on, you just kind of push it on.
Okay.
You never want to touch the blue part or the tip because those are considered sterile. So now that that's on, for this you just pull straight back.
Okay.
You're pulling back to 0.4. Doing the same thing. Injecting and pull back very slow on these because it's very easy to get air. You almost always get air in these. See the air at the top, so we're just going to push that forward and out. Flicks. There. 0.4. There. So now that our medication is ready, we're going to do the fluorescein angiography procedure first. Clean your work area. You're explaining the purpose of the procedure to the patient. So we're performing a fluorescein angiography to image the vascular supply in the back of your eye. You're asking if they have any allergies to any medications, injectable dyes, tape, latex, or any food allergies. You want to provide proper instructions to the patient. You're going to feel a pinch in the arm. You might feel flushed in the face. You might feel nauseated a minute or two after the medication goes in. If this occurs, let us know. We can stop taking pictures. It'll last 1 to 2 minutes and then subside. And their urine will be bright yellow for about 24 hours afterwards.
Okay.
Once that's done, you want to find your vein. You can move the arm, we confirmed with Dr. Wong, so if it's placed a little awkwardly, by all means, you can move the arm.
Okay.
So you want to find your vein. Once you've found the vein, you're going to assemble everything. Yep. So we're going to add. So this is what we give the injection with. Going to remove this part and put it in the sharps container, which we don't have here for that. We're going to take this off, put that in the sharps container, and twist this on. So once that's all done, we're going to apply the tourniquet. You want to make sure it's nice and tight, even if it's a fake arm. You're going to pull and take the bottom portion and tuck it into the top portion. Like that. That way it releases naturally, or with one pull. Now you put your gloves on. So I don't make a complete hip curve.
Sharp skip.
Sharp skip. So you want to make sure that with this, the bevel or the opening is up.
Okay.
And a good way to tell is these little wing guys have a little grippy to them, and that would be on your fingers.
Okay.
You want to anchor the vein with your thumb, and you're going to go in at a 45-degree angle. Nice fluid motion, and then you level out once you're in. You want to hold that down. You're going to pull back, and in the dummy arms, it'll have fake blood, so you'll see the red going up in the tubing. So you know you're in, you release your tourniquet, and you would slowly inject your medication.
So you pull back first and then push them.
Correct.
Okay.
And you want to say that you're checking for any swelling, redness, any expression of pain. Those are signs of extravision. And if those occur, you stop right away and draw everything up and try again. If you don't see blood right away, you don't panic. You just pull back, keeping it still in the fake arm, and just reposition. So you'd move over a little bit more where you think the vein is, and try everything again. So once you have your injection done, you're going to cover with the cotton. And put that in the sharps. And you're going to document. Injected 3 cc's of sodium fluorescein into the left antecubital fossa. Patient tolerated procedure well, or in this case, patient is displaying rash, complaining of shortness of breath, therefore we're going to administer 0.4 cc's of epinephrine. So you're going to once again explain everything to your patient. You're going to say you might feel flushed as well, you might feel a sensation of rapid heartbeat. Those are normal with this medication. You want to palpate the site, make sure there's no nodules or bumps, lumps, scar tissue. And once you've found your site, you clean using a circular outward motion. You give these at a 90-degree angle. You're just going straight down. Then you're going to pull back, make sure that you're not in a blood vessel, and slowly inject that medication.
So you don't want to see any blood in that?
Correct.
Okay.
Because it's IM. And you're going to put pressure, slowly massage that. While you do that, that goes into sharps. And once again, you're going to document. Making sure to state the proper elements of record documentation, the drug, the dose, delivery method, location. So 0.4 cc's of 1 per 1,000 micrograms, epinephrine into the left deltoid, patient tolerated procedure well.